In the next 45 minutes, we're going to focus on cluster one, which is health. We are going to listen to a Spanish national contact point, someone who will talk about how to achieve a healthy life in today's world. Some of the topics will be tackling diseases, access to innovative, sustainable, and high quality healthcare, and how the health industry is evolving. Please welcome to Juan Riese, Scientific and Technical Advisor in the Institute of Health Carlos III, Instituto de Salud Carlos III. Mr. Riese, all yours. Thank you very much.
Buenos días, espero que se me escuche bien. Tengo la pantalla compartida.
Good morning, I hope you can hear me. Thank you very much to Feuga, to Aida for the presentation. This presentation will be in Spanish. I hope this is not a problem, but the presentation is in English, as you will see. I'm going to speak about the opportunity and the novelties in Cluster 1, which is the one devoted to health, which is a continuation with some novelties, with some adaptations of what challenge number 1, health and well-being in the previous program. This is an a widening general image of Horizon Europe. In the center, we have Pillar 2, which is global challenges and European industrial competitiveness, and Cluster Health, which is the first one of all. Then it will speak about other topics. There is an increase in the budget. In Horizon 2020, it was 7,500 million euros. Now we have 8,000 million, more or less, which is an increase, 8,952, which is sent to different missions. So the money is distributed differently. Now we move on to the next slide, which is Clusters Health, which is distributed between 6 different destinies, which will be the general outline for all the calls. The first one for 2021 is closed now. The second one for 22 is still open. So there's different areas where projects can be funded in 6 different sections. So we have the different factors that promote health and which ones can be supported. Number 1 is staying healthy in a rapidly changing society. Number 2 is living and working in a health promoting environment. The third one has to do with specific study of diseases and reducing the disease burden and what we have to study to improve therapy and diagnosis system. Destiny 4 is a continuation of getting funding to improve the adaptation of the health systems. We have all the attention, all the tools, and the organization of everything that affects the maintenance of the health of the citizens and the sustainability and the adaptation to the great challenges we faced during the pandemics. Destiny 5 is the technological development of new tools based on the digitization of systems, based on the new opportunities that the new technologies offer. And last but not least, the development of systems that allow the industry of health industry and pharmacies and medical devices can be more sustainable and more innovative in terms of the environmental, more environmentally friendly and more competitive. some aspects that could be highlighted. This is a schematic exploration, but we could carry out analysis in greater depth of the text so that we can interpret what the European Commission wants and to make the research fit the demands. So we have around 900 million euros in the budget of 2022. So it's a huge opportunity to participate and get funding in the call for 2022, which has just been opened, 6th of October. The closing date, it's depending on the modality. If it's 2 states, the first one would be in 1st of February 2022 for a proposal of about 10 pages. And if it's positively assessed, you will get an invitation from the coordination of that proposal, and we will be working on the completed proposal, which will be the 6th of September 2022. And if it's only one phase, the deadline is the 21st of April 2022. The budget is always indicative. That's not the maximum. It's like around. It's always indicative. It depends on the type of activities you want to carry out. You can ask for higher funding if it's justified. So the activity you propose has to be fit the budget you're asking for. And in all the presentations, you need to mention the importance of collaborating with other projects which are financed in the same topic. So you have to program activities and you have to devote some money to these joint activities. It could be visits, meetings, or any aspect that you consider appropriate. Each topic has 6 destinies. The text is similar in all the different destinies. First, you explain the expected outcomes according to the goals, the targets that have been set in the strategic plan. These are then adapted to 2027, and these are the impacts that we have to take into account, which are common to all the topics that belong to the same destination. The call is organized by year. You have the number of proposals to finance is indicative, and then you have the conditions, which appendix you have to study in order to do the right proposal. So the conditions to be eligibility, which countries can participate, which cannot. Then you have a table with specific conditions. What type of action? Is it a research and innovation action, RIA, or an action for coordination and support, CSA, PCP, public pre-commercial purchase, or PPI, innovative public purchase. Then you have the description of the topic. There's a paragraph devoted to the expected outcomes and the results on the short term or mid-term, which we could expect from the project. We have also the scope, which is what the European Commission wants to see in its proposal so that this is correctly assessed or positively assessed. The basic outlines of the proposals, which have to be studied in great detail. Even if sometimes we don't mention this, it's very important to take into consideration the footnotes that give very clear explanations in order to understand what the Commission wants, and also for a link that could help you for the preparation of the proposal. Let's start with the description, which has got to be really schematic. You'll have a presentation. So you can see this in great detail, and you have to read the whole document. We don't have time to do this now, but I invite you to take this into account in order to deepen in the test. Destination 1, staying healthy in a rapidly changing society. This can be interpreted as how to study health in a society that's changing rapidly. This is developing new evidences, methodologies, and tools in order to understand what health is and how the health is affected in the transition from health to disease. Citizens must have better training in terms of health and the management of disease. They must be empowered at any age, and the health details must be available for different actors so that we can work better together in cooperation and offer cooperative solutions. The expected impacts, which are long-term, they don't have to be the framework of the project. They have to set the basis so that this is possible in the future. The citizens will adopt better lifestyles in terms of health. They will be able to pay better attention to health and the behavior, and empowering can be improved both for their physical health and mental health. Mental health is becoming extremely important, and we will see next that the specific topics devoted to mental health. We have also the trust of citizens in knowledge-based health interventions. This has to be improved, and we need some guidelines so that the health authorities can adopt the policies and implement them. Now we're going to move to a description. These are the opportunities for the year 2022. We have the 3 points here. This is the dates. We have 2 stages, and then we have one call, which is a call with only one phase, one stage. Now we have a topic related to mental health for the improvement of mental health in Europe in times of change. We are facing some really dramatic challenges right now. So what we want to see, we will see that in general, here we have a summary of the budget of around 7 million euros. Then we have a total of 50 million euros for this topic, 7 million euros per project. I always highlight in red what has to be taken into account for the proposal. All these items need to be taken into account as short-term impacts. We need to deal with them and take them into account. All the relevant actors in relation to health need to have a greater access to interventions that allow us to promote mental health and protect it. We must develop clinical guidelines, best practices, implementation guidelines, and so on, so that this is feasible. We also need to deal with emerging risks and contribute so that we have the general preparation of societies prepared in terms of mental health. We have to give access to new tools, and we must make sure that citizens are less stigmatized and marginalized due to the mental condition, which is an illness, as any other illness. In terms of the vision, we have moved from expected outcomes to scope, which is the vision the European Commission has of what any proposal, any competitive proposal must be. For this mental health topic, we need to take into account the 3 dimensions that are described below, and this must be focused on one or various of the effects that have been highlighted in the expected outcomes. So we must develop a knowledge that allows us to understand how mental health is influenced by this project, which factors intervene in this project. We must develop pilot tests with interventions that could be escalated. We can develop also materials educational and school materials and training materials that allows us to protect mental health, and also having aspects that allow the policymakers, inform policymakers for the decision taken so that society is better protected in front of the challenges that could threaten the mental health. Obviously, all this is based on digitization. Artificial intelligence has come here to stay. All the development of technological tools based on digitization of systems have to be taken into account, and this would be always positive factors to take into account. Here I have a second output in this destination, which is the development of artificial intelligence tools to predict the risk of chronic non-communicable diseases and or their progression. We have to point out that this and or details are important so that you know how much you have to develop the proposal, whether you need to introduce the risk or you also have to include the monitoring of the progression of the disease. These you can either do it or not, or have both things. The projects are around 6 million euros, and there is a total of 60 million euros, so 10 projects can be financed. The expected outcomes are specific outcomes that are expected. We must achieve these outcomes on a mid long term. We need to give access to tools based on artificial intelligence, validated tools. A pilot project in relation to this has to be included in the proposal. So this has to be validated and allow us to predict the risk of this non-communicable disease. We need guidelines for the implementation of prevention strategies, and we need to be able to use quantitative indicators that allow us to predict this risk of disease or of their progression. As far as scope is concerned, we have the different areas underlined, which all the areas that should be addressed. All these things have been really well thought about and must be included in the project. We must leverage the data we have from many different sources. It could be, well, health histories, genotypic, phenotypic studies, any type of data, any kind of quality data that can allow us to develop these predictive tools. We must develop metrics, criteria to determine the efficacy of these tools in the management of the risk of the disease. And we also need studies to validate these tools. Here we have the longest topic, which is the prevention of obesity throughout the life course. These outcomes, you can decide which you can choose. You do not need to deal with them all. So we have a really, really long list in the scope of different types of tackling this. So obesity is multifactorial, so we have a flexibility to deal with this. You can include different ways, different approaches. You need to understand the basic physiological sources, the development of clinical systems. You need tools for the management of the data and prediction of the risk of obesity. And also you need to develop prevention campaigns. And finally, we need citizens to have access and make use of these tools and services to make informed decisions about their lifestyles. In terms of the scope, we can address several of the following. You don't need to include them all. These projects are 10 million euros, a bit larger, a total of 60 million euros, which would allow the funding of 6 projects. Here, you can work in the understanding of biological pathways that make it easier for a person to gain weight, and also the lifestyle factors and socioeconomic factors of the. We can have a look at the pre-obesity biomarkers, mapping existing implementation research activities, and also conducting meta-review studies. There's a list that continues here. We can understand the relationship between obesity and other factors that affect the quality of life, and the design of a creative and engaging program. We also have to analyze the factors that unbalance the work life and the mental health, which can lead to the obesity. We could also analyze the obesity stigma, the aspects of inequality that could lead to an increase of weight. There's some vulnerable groups. We can develop strategies for the management of obesity, also tools for monetization, and so on. There's many ways of approaching this. The last topic of Destination 1 is the personalized blueprint of the chronic inflammation in health to disease transition. And we need to get to know this, which factors lead to this transition. So we have the expected outcomes. Several of them can be addressed. We can understand which factors of chronic inflammation trigger the health to disease transition, and we could move on to giving some counseling so that the citizens can improve their health. And we must also make sure that the health professionals have the right indicators so that this chronic inflammation does not worsen health. We must offer scientific evidence to the medicine professionals, health professionals, and we must develop some indicators for giving guidelines to managing the people who are in that situation. And we also want to inform the citizens so that they can improve their health and have the right tools for it. We have some projects here, which are 7 million worth. We would have 7 projects included here, the scope of the European Commission to deal with this type of proposal. For it to be competitive, you need to be able to use data to be able to understand what factors affect to a disease. We must develop and identify biomarkers. We must also understand holistically, based on our understanding on system biology, what is happening from a biological point of view, what is causing this chronic inflammation, how this could make the person ill. We must also develop robust sensors, devices that can allow us to monitor the situation. We must analyze the impact and also the development of the interventions. Regarding Destination 2, there's only one topic, which is studying which environmental factors are affecting health. So here the impacts that are expected are understanding these determinants, the improvements of the environment so that people have better health and are not affected by these factors, and improvements of the resilience, capacity of people, protection to citizens, improvement of their health, and allowing people to understand that the complex environmental factors are affecting their health. Now we're going to move on to the second topic, which is a topic with only one stage. These are methods for assessing, for understanding which are the costs implied in environmental stresses, factors from the environment that are affecting health. 4 million euro budget each project, so total 20 million for projects allowed. Expected outcomes, short-term outcomes. The authorities should have the capacity of modeling the environment and working on the impact of the environment, and in consequence, having rights, the policies, in order to be able to protect the people. With this, we would include any factor that could be determined, and all this must produce an improvement. The scope of the project, any data are important. We need accumulated data from the past 10, 20 years. We must identify the data gaps, and we always have to develop tools, methods, so that the experts can develop the right policies. Destination 3 has to do with tackling diseases and reducing the disease burden, understanding the mechanisms of the disease, why this is produced, how we can reduce the disease burden. Cancer is going to be covered mostly by missions. It will be, the call will be in December. We want to reduce mortality, improve the health systems, reduce the costs of the health systems, and also improving the empowering of the citizens. Here is where we have more topics. We have to move a bit faster. We have one related to the development of immunotherapies for diseases. Cancer is not included in this. And rare diseases and the medications and so on are not included for the funding of these projects. This is for the development of immunotherapies for the improvement of treatments of the disease. We must develop knowledge and mechanisms that are affecting this type of pathologies. We have a topic related to vaccines, next generation of vaccines. Obviously, this is a really current topic, very significant nowadays. We are going to develop studies of biomarkers, the development of processes that allow us to improve the process of the development of vaccines. We must ways of improving knowledge, discovery, research, understanding the mechanisms, improving the production, and so on. And so this allows to have new next generation vaccinations that are more efficient for infectious diseases. We have a topic related to rare diseases for the development of more efficient therapies. These are groups of rare diseases that have common mechanisms that generate a limitation to the approaches. We are dealing with groups of rare diseases that share some kind of mechanism. You need some kind of clinical trial or concept proof so that you can have new interventions available for the health system as soon as possible. This 8 million euro project that, well, 7 or 8 projects could be financed. We have another topic which has to do with the development of systems that allow us to reduce the risk of non-communicable diseases in adolescents and youth. This is focused on this age segment. This is a collaboration with countries of low resources. We have them in the OECD guidelines. We have all the factors that influence in this behavior, and what we want is to work on understanding these factors and proposing solutions, and also trying to understand the socioeconomic environments that affect and that set barriers to access to solutions.
Destination 4. We have 4 topics to ensure the access to high quality healthcare. We're talking about digital technologies, improving the quality of the healthcare, to take better decisions, and also to work on health systems that can have a smaller impact on the environment. Here are the expected impacts in the improved governance of mechanisms so that the use is improved, being more effective, in better training, also citizens having a better role in managing their own healthcare, also an improvement of health policies and synergies with the twin program of DG Santé, which has economic funds for the which is much higher to the ones that we've been talking about. Here we are talking about pre-commercial buyings. Here we're talking about projects where a public acquisition program needs to be developed. In this case, in order to develop systems that allow to improve the adaptation capability of health systems in a context of recovery. I'm not going to go into detail for the sake of time, and I'm going to talk about the news mainly. The most important message here is that the main core of this consortium must be financing agents that allow to finance implementation projects, focusing on solutions. In this case, we were talking before about pre-commercial public acquisition. In this case, we're talking about innovative acquisition, which is much closer to the implementation. That is, projects that focus on products, solutions, services that could be bought by health systems, by certain agents, and which could improve health as a whole. Here, there's also a coordination and support action. It's not so much about research, but rather about generating a conceptual database in order to improve the adoption or implementation of solutions based on public acquisition systems. We also have digital solutions and technologies based on artificial intelligence in order to have a long-term impact and to improve healthcare services. in order to have world-class technologies at the disposal of the health system. That's the view of the European Union in this sense, to reduce the level of disease as a consequence, and also to improve the quality of healthcare systems based on these solutions. These are three topics. Well, actually, they are one-stage topics in the case of the first one. In this case, it focuses on optimizing the effectiveness in patients of existing prescription drugs, which could be repositioned for some other conditions. The idea here is to have a clinical evaluation with the use of qualified biomarkers in diseases in general, but excluding cancer treatments and also rare diseases. In the case of cancer, that will be the focus of the upcoming calls. This is a 10 million euros project, and 6 projects could be financed in this case here. We focus on the work with regulation agencies in order to use real world data and synthetic data. That is, simulation-based systems or synthetic data systems that allow to make decisions by the regulation agency. That is, you cannot develop solutions which are technologically advanced without taking into account the regulation agencies. That's what this topic focuses on. Technology cannot make a lot of progress without the acceptance of the regulators. Development of computational models for new patient stratification strategies in order to predict treatments that could be more efficient, that could use clinical guidelines, of course, based on validation processes that will be disseminated in these projects. The last topic focuses mainly on the industry so that they can make use of the capability of digital solutions which public authorities could use with improved technologies or methodologies in the development of pharmaceutical products which could be used for existing needs in a much more efficient way. So in this case, the health industry in Europe, both the pharmaceutical industries and the medical technologies industries. As for topics, we have the enhancing cybersecurity of connected medical devices. The exchange of data is essential, preventing attacks by people and groups of hackers that are threatening the safety of data that are being moved in the European Union. The idea is to create good practices that can be followed by the stakeholders that are taking part in this process. Also, the anonymization techniques and synthetic data generation, that is simulations that allows us to get closer to the real physiological situation of the patient to accelerate clinical trials or any proof of concept that can simulate the real situation. It has a budget of 7 million euros and around 4 projects could be financed. Another topic related to the pricing, the way that technologies used in the field of health are being priced drugs, etc., because there is a high level of diversity in Europe. The idea is to standardize everything so that the Commission can make decisions based on the current situation. The possibility of setting up a European Smart Health Innovation Hub. This is also a field where coordination should be needed as part of this ecosystem to exchange data from clinical histories. Just quickly, we have 5 more minutes left. As for the updates, there's been a change in the general rule of participation. It must be a consortium with 3 entities from 3 member states or associates, with at least one of them establishing an EEMM. So the idea is to rule out certain entities for safety reasons. There's also changes in the application procedure. Researchers will have to show their scientific tracks. They have to show what they've done in terms of research. Also, the role played by organizations. There's also a statement on gender equality. In organization need to have a gender equality plan applied when they request this subsidy. There's also a glossary of terms with consistent terminology in order to help understand better what is requested in each section. Also, in terms of impact, we have the canvas model, and the idea is also not to harm, not to significantly harm the environment. There's also a questionnaire on safety and also information on previous activities carried out by the participants. As I said before, the cancer mission will have its own call. Partnerships are being developed. These could be opportunities for people who want to participate. Here we're talking about broad topics with just a minimum set of conditions that will be specified in the scope. In the future, some interviews will be carried out. Texts have been reduced. We are talking about 45 pages tops, and it's a two-stage call. The first one will be 10 pages and the second one 45. I would like to thank you for your kind attention, and at the European Projects organization at the Universidad Carlos III, we are at your disposal if you have any questions. As you can see, this is quite an extensive topic, so we need to do it schematically. But in any case, I would like to invite you to study the text of this call so that you can prepare yourselves adequately. Thank you.